kind of decided to do medicine after serving as a missionary in the inner city, in the south side of Chicago. One of the big things I liked about Hurley Hospital was it was a very underserved population of patients that this hospital provides an immense service to this whole community. A lot of the care that we provide is really subspecialized neurosurgical care. Skull-based neurosurgery really involves all kinds of surgeries that are dealing with the base of the skull. So we deal with aneurysms, we deal with lots of different types of tumors. I went into neurosurgery thinking I was going to do pediatrics, and I trained at the University of Utah, which has one of the world's top pediatric programs. But then I ended up really being gravitating towards older patients, because there was a group that was understudied. I was able to get into frailty research kind of really before it had kind of caught on in neurosurgery. Frailty is really measuring, it's assessing the amount of reserve, physiologic reserve a patient has. There's a big shift in patients getting older. And so with that, we have patients that are older that are presenting for neurosurgical consultation. We've been fortunate enough to kind of be the busiest producers in all of the neurosurgery in the world on this topic. And it's actually massively important because the demographics of the United States and around the world in most developed countries is what we call this silver tsunami, which is this wave of older patients. I think we clearly are leading the way in this regard with respect to frailty, for example, and like factoring in risk stratification, or that is to say, helping patients and other clinicians when we talk about interventions, what are the risks, and being able to better identify who is high risk, and then what can we do about it. I think it gives us a big advantage by just the fact that we write, every month we're publishing papers in this space, and we're always constantly, doing research and trying to find ways to get better outcomes for people that are frail and older patients in general. It's a whole team of all these different specialties. Our goal here is to provide everything in this hospital. They can get all their care here, and it's really rewarding. Having someone that is an expert in frailty or is centered on frailty is super important no matter where you are in the United States and most of the world. But when it comes to brain and spine tumors, diseases of the skull base, people don't want to travel long distances. And so for the first time opening up a comprehensive skull-based program and center and neurosurgical oncology, your brain tumor program is going to save people, travel time. And really we know that travel time can lead to worse outcomes for lack of access to care. It's something we're really proud of, to be able to provide that top-of-the-line, state-of-the-art technological care here for the patients. By every day when I work here, you feel like you're making a big difference.